Hello, I'm Donald McCauley and welcome to this BMJ Leader conversation where we talk to the key opinion leaders in health and medicine around the world. Today I'm talking to Nagina Khan. Nagina, you have the most fascinating academic career, but I want to bring you back to the very beginning because you had a very interesting start in mental health. Tell us about that.
Yes, that was an interesting time. So I always wanted to be part of impacting research. And then really it was related to my clinical practice as well, so that we could use what the outcomes are for people. And at the time I was working in dementia services for older adults. And I was looking at appropriate care for older adults that were of ethnic minority communities and backgrounds. And that kind of propelled me to want to look at outcomes and also looking at formal care and why people didn't utilize those services.
So tell me about this transition from service in mental health to the first steps in academia, the very first steps.
The very first steps were really doing small projects or anything that you are interested in. Like I was interested in looking at why people had this vision and view of mental health services where they didn't want to utilize, formal services. And I think mental health does get viewed mostly quite critically compared with other disciplines within healthcare. And I think that's throughout the hierarchy of healthcare as well. And sometimes I think when funding is allocated, it feels like that as well in terms of mental health. When mental health, in actual fact, is a very important area for people to be interested in and to have actual say in this, whether you're medical or not. I think it's an important place for people to feel and especially now, we know that mental health is so important just as much as our physical health is.
Well, you clearly were interested in that, asking those questions when you were in the service job. But where were the steps? Did you do a degree then, and then how did you move on to further that career?
I realized that um, for me to progress in my career and also for some of the steps that I wanted to do, I needed to seek out opportunities and academic links to how could I get there. And one of the things was that I had really good mentorship quite early on. And I had two people, one for clinical mentorship and one for educational as well. So I was very lucky at the time. And these mentors I still know today as well. So it's really special relationship. And they were able to guide me at the time. So I went on to do a health sciences and I had a first class um, honors degree in that. And then I went on to do sort of and I realized I needed to get from healthcare to medical research. So I needed to undertake some courses. So I applied actually initially for a master's, which was on looking at transition from health service research scenarios to medical research. And that kind of gave me the leverage to think that, I could develop further in this. And also it highlighted that there's a balance between both working clinically and academically. So I didn't feel like I was leaving anyone behind.
Well, you talked about the clinical and the academic, but you had another component of your career, and that was you were the face of an NHS recruitment campaign. Tell us about that.
That came about because it was really linked to the way that I was working and the passion I had for people and mental health services. I really wanted people from different backgrounds to reach out. And also in terms of the workforce, I think this is linked to some of my work now around inequalities and really working with different communities and workforce to develop different people. And then there was this scheme at the time to promote nursing in for different backgrounds at the time. And this is a long time ago, so I'm surprised you even know about this. So I was on the campaign. They did a lovely, poster of all healthcare professionals from different backgrounds. I met loads of lovely people. I was able to contribute to I think the way people saw nursing as well, because I don't think nursing was an attractive career for individuals of an ethnic background at the time, especially South Asian.
Well, I'm absolutely fascinated because with all these components, with the academic, the clinical, and this public recruitment campaign, you then moved on to do this MRC PhD fellowship. Tell us about that.
That was an amazing time, and I had the most amazing supervisors. I had Professor Anne Rogers, who's just an amazing person and just an amazing role model for me. So when I actually found out that Professor Anne Rogers was going to be my supervisor, you can imagine how thrilled I was to be able to be guided by someone so important and really close to my passions as well in mental health research and looking at people's experiences and lived experiences and coming from a different angle because I studied health sciences. If you know how we chatted about how I came into this career, so health sciences also covers psychology and sociology. So I didn't just work from a medical perspective, uh, even though I had clinical roles and developed in them. So it was interesting for me to be able to come and do this work, this piece of research that was my piece, and I was able to have the support to look through different lenses. And I think that is a powerful way, to develop a kind of a broader understanding of the issues. And especially if you're working with people, you need to be able to take on the different backgrounds and how people come to services and why have they accessed them and what's happened before prior to contact that led them there. And I think that's fascinating.
What I really loved was the content and the subject of your research because it's very, very grounded in practical care. Your postdoc work, that really interested me. Tell me about that.
My postdoc was undertaken at the NIHR School of Primary Care, and at that time I'd moved on to working with a professor who was a GP with a specialist interest in mental health. And I think that was that was interesting because I wanted to also move into looking at my PhD was around depression and mild to moderate in primary care. And I did come back from a secondary care focus. So this project was not secondary care, but it was actually looking at individuals who were young individuals with first episode psychosis coming in to utilize services. Um, and and we wanted to look at how this service would actually impact individuals who wanted to actually continue their lives and continue their whole trajectory outside of hospital-based care, but also have that intensity when required. And that was really important because it was young people who were having perhaps the first episode in psychosis. So, how did they deal with that, and how did everyone around them? Because families matter a lot.
Well, together with your academic work in the UK, you have quite a lot of international experience. Tell us first about your work in Canada.
Canada was an interesting time for me. I also worked for a non-profit, and it was called the Compass Food Bank, and it was an outreach center as well. And my interest stemmed from working with people experiencing homelessness because it was actually situated in a really affluent area of Ontario, in just outside Toronto. So there was pockets of poverty around as well, and that really interested me. And at that time, I wanted to be able to give back to communities and people that were out of like a faculty domain. and also services like formal services. So you saw that I was part of formal services, and it always interested me what was happening, before people came and what was going on and who was supporting individuals. And, I had contact with people, like I worked in the community, I had involvement with their families and care packages and health and social care and medicine. And I knew all of that area, but I also wanted to know about what happens in not-for-profit and how people are sometimes happier to engage and then have a hard, stop and a boundary where they don't want services. So for me to do that work was also looking at how we impact people's lives from different settings in the different ways and approaches that we work, and how different institutions like a nonprofit works as well. And I think that's really important, especially as you saw my work from my PhD was looking at lived experience of individuals and how they use self-help. Then it moved into how young people access services like early intervention services, and how that is experienced by them and also how it's experienced by their families, and how we can input that and make that improve that. And then we went on to looking at how I worked at the Center for Addiction and Mental Health, looking at adapting CBT with a team over there, and then culturally appropriate care. But I don't think that culturally appropriate care is so different from looking at place-based care for individuals, because I think you need to work with the community that you're situated in and look at what their needs are. And you can't always do that from sitting in a hospital or an academic university building. You won't know who's going to come through the door. And if it's someone homeless, if it's someone not homeless, if it's someone with different challenges, and you cannot be judgmental, because you cannot judge the way how someone looks and take that information. You really need to be able to speak to people, and people won't tell you everything. So you need to build trusting relationships, have good communication, and really to be compassionate and kind, because any one of us can be in those positions at any time of our lives.
And then I was fascinated by your work in the USA on professionalism in undergraduate medical education.
Absolutely. That was an interesting time during COVID, working remotely with Touring University, Nevada in Las Vegas. That was an interesting project. And that was really to kind of bring research at an earlier stage to a medical school, because at the time we didn't have a lot of curriculum that focused on merging research at an earlier stage, and that was research from an independent kind of perspective, looking at research so that people can lead different parts of it. And that was interesting to be able to meet students and kind of get their perspective on how they feel and think about research. Because prior to that, I've always worked with healthcare professionals, and that's different, to be able to work with students at that level and to introduce topics that might not have been introduced to them earlier on, and also have a different way of working to individuals with a medical, like a clinical medical background, like doctors, etc. It's more multidisciplinary, and I think we can learn from each other, having a multidisciplinary lens to research and working together. So that was an interesting time to learn about students and how we can feed that back into curriculum and create a curriculum, and allowing them to have that opportunity for leadership. I really sort of mentoring them, looking at ways for reflection, how they can grow and develop, as well as the project, and then having opportunities to present as well that work in poster presentations and for dissemination, and really making it real, and not a project that was at a university kind of focused.
Now, bringing all these different themes together, you wrote a piece recently and you quoted Aristotle that the purpose of knowledge is action and not knowledge. And the message was it's not just enough to know things about culture and inequality. We need to do something. Tell us more about your views on this.
Yeah, I think we all need to take a stand, and you can see that a lot of my work has been rooted in inequality and social justice. And I think that is everyone's business, and we need to actually look at that and be active as well. And I think that also fits in with my work with the students, calling for action and looking at professionalism and vocalizing, um, you know, their situations and their understanding from their point of view into curriculum, and then looking at culturally appropriate care. How can we bring in lived experience voices into interventions and then ultimately mental health services, opening up access and pathways for individuals that feel marginalized from services. And I think that has led me to believe that. And I think that quote is important because it's led me to places where I've been part of and been part of the action and not just sitting thinking theoretically what my role is and how I can do my work and how people can develop. And for mentoring, it's also been important for me to be able to allow people to grow and let them know that, you know, that there's no one way of doing things, because I think faculty thinking and being in a traditional pathway in healthcare and academia is very different to someone like myself who's taken a step out to look beyond the building and the brick and mortars of what's going on outside. And I haven't done that just because we've had funding change or a policy change. That's been embedded in my work from the beginning of my actual career. And when I talk about it, I think for me it's been a reality rather than reading it in a paper or thinking this is going to look good on my CV. Or and I think this also links into when people talk about authenticity. And sometimes people ask me, what's your leadership style as well? And I think it's really servant leadership and collaborative, you know, because we have to get our hands dirty. And we live in a world where there's a lot of inequalities and people have experienced hard lives. So we need some compassion. And we can't get that just from reading about compassion. It has to be an action as well.
So finally, let's bring you right up to date and tell us about your current work.
My current work is really interesting at the moment because I'm working as a senior clinical research fellow at the Center for Health Services Studies. And my role really at the University of Kent is supporting integrated data care systems in an ICB in Kent and Medway. And that's really interesting for me because this now brings me full circle from what I've done to where I am now, working with communities, embedding research in primary care to improve service delivery and to prioritize research in underserved populations, and then addressing health inequalities. And so the methods that I use now are really around championing public and patient involvement. And this is really a sweet spot actually to be in. It's only taken me all this whole pathway and career to get to where I am right now. I'm working in an area where I can, give a voice to this and really work in ways that embed those methodologies and really help to bring those methodologies into publication. So this is why I also like working, in editorial roles with various journals. I'm working with BMJ Leader, BMJ Mental Health. I've worked with BMC Med Ed journals. And I think this is important because it utilizes research and publishes research in a more traditional way in the past, but now we're opening up and looking at ways to include individuals with lived experience on the board, having people write about different schemes, programs, interventions using more creative methods that ordinarily journals didn't really know how to review and get into publication. So making that happen has been quite important because I think it's empowering. It's empowering and actioning work that, wouldn't get published in the past.
Thank you very much for sharing so much of your life, your early career, the integration of the practical and the theoretical, and finally giving a voice and bringing real work into publication. Thank you very much indeed.
You're welcome. Thank you so much for having me.